In November of 2019, a mysterious pneumonia appeared in Wuhan, China. The strange virus then appeared in Thailand, followed by Taiwan. By March 1st, the first case was confirmed in Manhattan.
And then on March 11th, COVID-19 was declared a global pandemic. The United States soon went on what we thought was going to be a temporary 2-week lockdown.
At that time, the CDC had confirmed nearly 17,000 cases in the United States. Just 10 days later, the caseload jumped to 40,000 and the numbers kept climbing. By that time, the virus was already in Horry County. Conway Medical Center had its first COVID patient on March 17th, and hospital staff quickly realized how much they didn't know about the virus.
The pandemic was tough. I mean, let's be honest. Even though it's been 5 years, it's still just as fresh in my mind as it ever was.
Dr. Paul Richardson remembers the staff scrambling to follow shifting guidelines for testing, treatment, and protection.
It literally was evolving and changing day to day, literally, for us as healthcare providers.
These changes in protocol led some people to distrust science.
Oh, wait a minute, you said X last week, now you're saying Y this week. Well, frankly, it was changing pretty much so day to day for us.
But Dr. Richardson says that learning curve is part of the process.
It's part of the way we do learn. So I think that's one reason why people, are, oh, well, this doesn't exist or whatnot. No, it's just that's the way science works.
Staff converted hospital hallways into isolation chambers for COVID-19 patients. They built intubation tubes to prevent transmission. Makeshift MASH units were set up outside for triage, testing, and treatment.
You think about, well, hey, as nurses and doctors really took the brunt of this during COVID, but yeah, they were working hard, but so were our EVS staff. They had to keep everything clean. So were the people that took the trays to the rooms. Everybody was doing everything they could during that time. So that, to me, is the number one lesson. It just, once again, revalidated in a very extraordinary way how superheroes these people are.
The hospital implemented a universal masking policy. The main entrance was closed to visitors, and in many cases, iPads were the only way patients could see their loved ones.
I've been at this almost 30 years and had never seen this.
Another challenge to frontline workers was being exposed to the virus without bringing it home to their families.
I heard numerous stories of people who would go home, take all the clothes off of them here, like in a garage or whatever, run right into the shower.
Hospital workers were also exposed to people who didn't believe COVID was dangerous.
Listen, I witnessed it. I was an eyewitness to what happened. Hence the reason, I'll be honest with you, it gets me very frustrated when I hear things or I see things posted now that, oh, it was a conspiracy. COVID didn't really exist. I will absolutely 100% testify, COVID exists. It existed very much.
Indeed, the coroner said there's no disputing a dramatic spike in the county's mortality rate.
What we do know is that our numbers went up drastically from the year before to the year of 2020.
Tamara Willard with the Horry County coroner remembers not having the necessary equipment.
We had a really hard time getting protective gear, body bags, things of that nature that we need to work every day that we just couldn't get.
Or the storage space to accommodate those who passed.
Oh, it was unbelievable. It was unbelievable. That cooler had enough shelving racks to hold 16 individuals, and at any given time we would have 3 or 4 additional stretchers in there to give families time to make decisions.
Well, staying home to stop the spread brought its own set of problems like isolation, depression, and anxiety. For some, the fear of the virus was too much.
We did have a few suicides from people that were so afraid of COVID. I don't know that people know that. They would rather go ahead and end their life than to worry about when and if and how. And we did have some suicide notes that were reflective of that.
There were over 1 million cases of COVID-19 across South Carolina. In Horry County, 1,159 people were lost to the virus. Thanks to President Trump's Operation Warp Speed in 2020 and President Biden's vaccine rollout in 2021, we mitigated a deadly pandemic. Dr. Richardson says despite the conspiracy theories, it was the science that saved us.
The bottom line is if we want to stop the spread of disease, we use vaccination. We use vaccination. I'm a pro-vaccine guy of all sorts. So we use vaccination. We wash our hands. We're sick, we stay home so we don't spread it to other people. I mean, common sense things work and frankly are not debatable.
Looking back, he reflects on frontline workers who he calls superheroes.
It didn't start here at the hospital. It didn't stop for them. It never. I mean, there was no escape for these folks, but yet they came in every day, did their job, did a magnificent job to take care of our community and folks in it. And so I just can't say enough good things about the people in this building.
And in December of 2020, Dr. Stephen Brady became the first person in South Carolina to receive a COVID-19 vaccine. Over the next 3 months, Conway Medical Center administered more than 30,000 doses of the Pfizer vaccine.
And by May of 2023, the World Health Organization declared an end to the pandemic. The CDC says that now about 64% of the United States population is fully vaccinated and protected from the virus. News 13 would like to honor the frontline workers who risked their own safety to ensure ours.